Good evening, distinguished colleagues, ladies and gentlemen. As a part of PSI Foundation Week celebration, this is the third day and third lecture of the lecture series. As you know, we are just going to celebrate our 92nd Foundation Day. So I'm thankful to all the team members for which we are capable of conducting such a huge task. I must convey my thanks to all the resource persons for spending their valuable time with us. I'm also thankful and grateful to to my live members of the Physiology Society of India for their trust on me and our team of the executive committee members. Uh, Basically, we are trying our best. We are giving our level hard work to make every possible uh, difficulties to reality. So it's my duty now to introduce Sri Dipankar Pal. He is basically a visiting faculty member at the Department of Sports Science and Yoga at Ramakrishna Mission Vivekananda Education and Research Institute, Belur, where he contributes to uh, courses such as yoga psychology and counseling, applied yoga, and yogic lifestyle management. His education started in the Presidency College. He completed his graduation in physiology from the Presidency College, and then he completed his master degree, that's the MSc in physiology from University of Calcutta, known as Rajabhara Science College also. Then he also completed his master degree in psychology, and thereby he completed a Bachelor of Education. Sri Dipankar Pal actually specializes in the intersection of physical wellness, human anatomy, and psychology. His teaching and research often focus on applying yogic principles to improve mental health and daily life well-being. He is frequently invited as a resource person and expert speaker for seminars and camps focusing on the common yoga protocol and physiological health. So, uh, I welcome uh, Sri Dipankar Pal. Please, it's your time to you can start. You share your views with our audience. Thank you for coming.
Shall I start? Am I audible? Am I audible?
Yes, yes, you are audible.
Ah. Good evening, everybody. Welcome to PSI Foundation Week 2026. At the beginning of this talk, I must congratulate Dr. Prashanpriyo Nayak, the President of Physiological Society of India, Dr. Rajen Hallar, the Secretary of Physiological Society of India. My, my today's topic is role of physiology in mental health. To begin with it, I must say what is mental health? World Health Organization defines mental health. It is a state of well-being in which an individual realizes his or her potential, can manage adversity, can work productively, and is able to make a contribution to his or her community. Let me explain it. Realizing one's potential means ability to identify and utilize one's cognitive and emotional abilities. Secondly, can manage adversity, can cope with normal stresses and challenges of life. Our life is full of stresses and challenges from the beginning of it. And we cannot live without stress or challenges. We have to know how to manage it. And a mentally healthy person can manage normal stresses and challenges of life. Can work productively means learn and work well, allowing to be productive and fruitful. Lastly, is able to make a contribution to his community means capacity to engage with and give back to one's society. That is unselfishness and not just absence of any mental disorder. We all have mental health, but some of us have mental health issues or problems. Generally, this includes mental disorders, psychosocial disabilities, impairment of functioning, risk of self harm, which affects our daily life, relationship, I mean, in the friend circle, in the family, in the workplace, and also our physical health. To understand the gravity of the situation of mental health, there are the incidences of mental health is very high. In every 7 persons, one person live with mental health problems globally, and this is about 1.2 billion, about 120 crore globally. It is much more than diabetes, heart disease, and cancer. And if we compare it with diabetes, 590 million means 59 crore people suffer from diabetes. About one person per 9 or 10 population have the problem of diabetes. Among the mental health issues, anxiety and depression are most prevalent, and they are increasing very rapidly. Since 1990, the incidences of anxiety and depression have rose to about 100 to 100% nowadays. And depression is the largest contributor of disability. Depression is strongly related to suicide. 0.7 to 0.8 million people means 7 to 8 lakh people commit suicide every year globally. This is very alarming. And this is the third leading cause of death among the age group of 15 to 29 years. And the rate of the incidences of mental health issues are high among adolescents and young adults, not in the adult population. Now, let us understand what is anxiety, what are its symptoms. If we divide the symptoms into two halves, the physical symptoms and the mental symptoms. Physical symptoms include heart, rise in heart rate, the palpitation, uh, and it is due to sympathetic activity. Physical symptoms increase, the heart rate increases. When we become anxious, we see if we feel the pulse, it has gone up. And there is also shortness of breath. The breath becomes irregular, and also there is shortness. It becomes irregular and short. Suppose when you become anxious, you may feel yourself also the irregularity of your respiratory rate. Dizziness or lightheadedness and also headaches are also common during anxiety. There is sweating. Sweating means emotional sweating. There are other kinds of sweating. When we eat spicy food, then we also sweat. This is called gustatory sweating. And if we go to a place hot and humid, we also sweat. That is thermal sweating. And when we face emotional strain, huh, we feel anxiety, then we also sweat. Suppose we have gone to any stressful situation or like that, if we go to any interview and can't answer any question, immediately we may start sweating. There is stomach discomfort. Stomach discomfort, butterflies in the stomach are very, very common. Muscle tension. When we become anxious, if we put our hand on our cheeks, we feel that muscle has tense and they are. And you also realize when you smile, the tension is not there. Regarding the mental symptoms, there is constant worry or fear. There is constant uh, fear of negative outcomes only, not any positive outcomes. You only see the bad consequences only. And feeling of restlessness, you cannot sit at a place in a relaxed way when you are anxious. And sit on the edge when someone enters the interview room. You see, he is not in a relaxed posture. He sits on the front part of the chair. Huh? That means on the edge. It is also a symptom of anxiety. Difficulty in concentrating. Huh? Those who have high level of anxiety, they make silly mistakes in the exam, especially in the mathematics exam. There is also irritability. Irritability means when you ask a simple question, "How are you?" becomes irritated and becomes angry. Sleep disturbances. Sleep disturbances mean the onset is delayed, awakening is early, and the duration of sleep is less. And in between this sleep is not sound sleep one. And in a sense of doom or panic. These are all the symptoms of anxiety. Now comes the symptoms of depression. Persistent sadness or low mood. The word is persistent is very important. If you become sad by any news, that it is not a symptom of depression. But if you are sad for more than 3 weeks, 4 weeks, or more than that, and your mood is almost low all the time, then it is a symptom of depression. Loss of interest or pleasure. Suppose you used to take part in a game or used to you love to visit shopping malls, but you don't feel interest now. Hmm? And you feel bored or least interested. You feel um, uh, don't any pleasure. The anhedonia means you cannot enjoy anything. There is changes in appetite and also body weight. You can see you see that if the body weight changes by more than 5% in a month, then it is a symptom of depression. Suppose your body weight is 60 kg and 5% of 60 kg is 3 kgs. And if your body weight changes more than 3 kgs, like suppose 4 kg or 5 kg in a month, it decreases, then you have to make notice of it. Sleep disturbance means onset is late, early awakening, and the duration of sleep is also less. Fatigue or loss of energy. Loss of energy or fatigue without doing any hard work. This is the symptom. Tired of doing nothing, like that. Feeling of worthlessness or guilt. Feeling of not only worthlessness, hopelessness, helplessness, and worthlessness. Hopelessness means there is no hope for me. I'm doomed. Helplessness, there is no one beside me, my friend or relative, who is going to help me. Helplessness. And worthlessness, nothing will be possible, my dear. And guilt that is must be inappropriate. Suppose a student may feel my parents are spending so much money, but uh, I'm not doing well in the examination. The guilt must be inappropriate. Difficulty in concentrating, the same thing. Slowed movements. There is psychomotor retardation during depression. Your movement will be slow, your speech will be slow. And the most notorious thing is recurrent thought of death or suicide. You may think of death, you may plan for suicide, you may make an attempt for suicide also. Huh? These are the symptoms of depression. Now, what is the relation between physiology and mental health? Previously, it was thought that body and mind are separate entities. They're quite different. But modern science has proved mind and body are deeply connected dimensions of the same human function. They're the two different aspects of the same thing. And their body and mind, physiology and mental health are dynamically related. How? Suppose any physiological parameter, the level like the level of hormones or neurotransmitter are directly related to mental health status, like mood. Hmm? They are dynamically linked. If one goes up, another goes down, like that. Mental health is mainly rooted in the structure and functioning of neuronal circuits, that is, brain or central nervous system. And the neurotransmitters play a very important role in our mental health condition. Now, what are the advantages of knowing physiology? It helps us to, the knowledge of physiology helps us to detect the mental health conditions in the preclinical state. If you see that someone's the thyroid level is going down, you may anticipate that he may or she may have uh, depression in future. It also paves the way for better treatment and integration of parameters of physiology and mental health gives a deeper and better understanding, and also paves the way for future research. Now, what are the symptoms from which you can detect early the mental health problems are going to come? Firstly, the behavioral changes. What sort of behavior? Social withdrawal. A person restricts himself to the home or room environment, doesn't go to any social gathering, market, or like that, doesn't attend any social gathering, hmm? And doesn't communicate also. Secondly, performance drop. Performance in case of students, it is the academic performance. Huh? Suppose a student is very bright student who used to get 80% or 90% marks in all the exams, but suddenly he started getting just pass marks only. That means his performance drop is an indicator of early mental health problems. Neglecting self-care. Neglecting self-care lies doesn't take bath regularly, doesn't brush teeth regularly, or doesn't change dresses, shirts, or other things regularly. It's the symptom of mental health problems, and it is seen in during the early phases of schizophrenia. Nowadays, the abuse of drug and alcohol has increased. People wants to cope up by themselves by the use of alcohol or drug. And if you see the certain boy or girl or certain person start consuming alcohol and profusely, and it is increasing day by day, then it is an early symptom of mental health problem. Next comes emotional changes, mood swing. Mood sometimes becomes high or sometimes low, sometimes cry, sometimes laugh. Huh? There's swing of moods, and mood becomes low or high. Huh? Irritability. Person becomes irritable. If you ask simple question or some certain irregularities, gets him irritated and becomes angry. And the anger, which cannot, sometimes the anger cannot be controlled, uncontrolled anger. There is also fear, uncontrolled and irrational fear. It is called phobia. Suppose a person has a phobia of height. This is called acrophobia. If he goes to a multi-story building and goes to the top floor, he cannot look out of the window or go to the balcony. This fear is irrational. Huh? If it is rational, then it is okay. But if it is irrational, it is known as phobia. Cognitive changes. Cognitive changes means is confused thinking. If you ask somebody to describe something or write an essay or paragraph of something, if you read out, you can't make any meaning of it. Huh? And hallucination. Hallucination means false perception, huh? In absence of any stimulus. Suppose a person stays in a room and he says, someone is calling me from the heaven, like that. Huh? Hallucination. This is a auditory hallucination. He hear many things, huh? When there is no one in the room. And visual hallucination, and he sees many things that is not before his eyes. I met a boy a few days ago in my native place. He has shop. He stopped his shop, and I asked him, "Why didn't you open the shop?" He just said, "I met God, and He asked me to do something like something, some work like that. I want to open the shop." Then I realized he has the symptom of early symptom of mental health problems. It is a symptom of schizophrenia. Hmm. I asked his family members to consult doctors, psychiatrists. Delusion is the firm false belief for which there is no evidence. Huh? Contrary to evidence, the firm belief. And suppose one thinks, I am the president of the United States, like that. Paranoia, extreme mistrust and suspiciousness. Suppose one may think that his neighbors are wants to harm him by putting poison in his drinking water. Always there is no basis, but he thinks which has which is completely unreal. Next come physical changes. Disturbed sleep. Sleep is very important parameter of our mental health. Appetite shift. Either it increases or decreases. You may see, notice the people when they are stressed, they crave for uh, comfort food like chips, cold drinks, like that. Huh? And when he is in depressed state, he eats less generally. Sometimes he may eat more, but generally they eat less. Unexplained physical symptoms, unexplained headache, unexplained gastrointestinal problem, for which there is no physical cause or real, doctor cannot find any real reason behind it. They are the early symptoms of mental health. Now, what the neurotransmitters, what role the neurotransmitters play? There are main three neurotransmitters: serotonin, dopamine, and non-epinephrine. When their level is normal, they are in balanced condition, we have normal mental health, normal mental status. and the mood is stable. But when the level is altered, we show the symptoms of mental health problems. One by one. Serotonin, the pleasure hormone. When its level is normal, we feel pleasure, huh? We feel relaxed, we are contented, and we show positivity in our behavior. Dopamine. Dopamine is the reward hormone. When we get something as a reward, internal reward, not always external reward. Suppose we eat a chocolate or ice cream, get a lottery, make a good result in the exam. There is secretion of dopamine from the reward circuit, and it is a case of positive reinforcement. We want to repeat that process that leads to our motivation, also to the addiction. That I'll come to that later. And uh, next comes next comes non-epinephrine. Non-epinephrine is also a neurotransmitter. Mainly, it focuses on fight or flight when you face a problem. Suppose you see a cobra just beside me. If you cannot kill it, we'll run away from it. This is the fight or flight situation. Arousal, memory retrieval, huh? And all these neurotransmitters balance keep our mood stable. Now come to the one by one. Serotonin, the feel good neurotransmitter. It is made up from tryptophan and essential amino acid. It regulates our optimal physical healing, sleep, and mood regulation. For you may notice the people with depression have uh, there is dysregulation of serotonin, and it is mainly produced by the gut. The microbiome, the bacteria, and other microbes in the gut, they make the 90% of the serotonin, while the brain produces only 5% of it. What are the effects? Low effects. You can see the main effect is depression, and another is anxiety. We feel anxiety and we feel stress, and there is mood swings. We feel we are at a low mood due to low serotonin. And the associated symptoms like this shortness of breath, headaches, dizziness, mental fatigue, concentration, lack of energy, trouble of sleeping, or loss of appetite. These are all the symptoms of anxiety and depression. Now comes dopamine. It regulates the brain's reward system. Means we are internally rewarded with the help of any reward if we perform any job or like that. It's the reward system. It also motivates us to do some job. It also helps for movement and keep us focused for any job. Then what are the effects of low dopamine? You see the same symptoms: depression, anxiety, and mood swings, low sex drive, lack of motivation. Dopamine is responsible for motivation. Loss of interest in many activities. This is of anhedonia, what I have told. Lack of interest or loss of interest is a symptom of depression. Difficulty in concentrating or focusing, it is a symptom of depression and anxiety. Sleep disturbance also is symptom of both anxiety and depression. Hand tremor and restless leg syndrome and gastrointestinal issues. What I told you earlier, it is the feeling of butterfly. Another interesting disease. This is seen among the school-going children. ADHD, attention deficit hyperkinetic disorder. Attention deficit means he cannot concentrate, a child cannot concentrate in to a particular job. And then he shifts to another without completing the first one and easily distracted. Suppose someone is passing by the room, he just runs away and looks for what is happening outside. And hyperkinetic means hyperactive. And the children in the school cannot sit for a long in his chair or place and roams about, huh? Roams constantly and becomes overly talkative and also impulsive also. Huh? Um, the parents of these children often get guardian call from the school authorities. Huh? They are very annoyed with ADHD children. Then what are the effects of excess dopamine, high dopamine? When we get unnatural rewards, huh? From drugs, alcohol, gambling, social media, so dopamine surge occurs. But it is not such a. We also get a dopamine surge when we do a good result after hard work. That is natural reward. But if we get the social media is designed in such a way that it is designed in such a way that it generates the reward circuit of our brain. The the persons behind it have designed it this way that people are glued to the screen and the duration they spend after the screen, their revenue is generated. And this is a social problem nowadays among the students, young adults, adolescents, the social media smartphone addiction, what I should say. Next comes schizophrenia. The two main symptoms, the hallucination and delusion. Hallucination means false sensory perception in absence of any external stimulus. People may hallucinate auditory hallucination, hear voices, sees things, like that. Delusion, the firm false belief, in spite of clear evidence to the contrary. Mania, this is seen in bipolar disorder. Bipolar means two poles. One is in excited state, one is in depressed state. When they in excited state, it is called mania. There is extreme euphoria. People becomes overactive. There is lot of aggression, loss of impulsivity, loss of sleep also. These are the effects of excess dopamine. Now, the symptoms of non-epinephrine. Huh? Non-epinephrine, it acts through sympathetic system. It is if it is level is low, then there is fatigue, difficulty in concentrating, low mood, and other symptoms. If its level is high, there is high anxiety, rapid heart rate, and high blood pressure. And if it continues for this for a long time, along with cortisol, there are symptoms of hypertension. Apart from neurotransmitters, there are other systems also, that physiological systems that regulate our mental health status. Suppose when we perceive a stress, when we see a danger in front of us, the brain perceives it. huh? And it stimulates our hypothalamus. Hypothalamus then secretes corticotropin releasing hormone, and these corticotropin releasing hormones stimulates the pituitary gland. Pituitary gland in its return releases adrenocorticotropic hormone, which again stimulates the adrenal gland, adrenal cortex, to release cortisol. Cortisol is a stress hormone. In short bursts, it is useful. It sharpens the focus, mobilizes the energy, helps to respond for immediate demand. But under prolonged stress, it starts damaging the very systems it is designed to protect. That I'm coming to that slide also. High mental, they are high cortisol. When the cortisol level is high, the symptoms is difficulty in sleeping, irritability, restlessness, muscle aches, fatigue, and no concentration. It is the stress hormone, and uh, when the it is the cortisol level is elevated for a prolonged period. What I was saying, uh, it shrinks the volume of hippocampus, meant for memory. Hippocampus, there is suppresses the new generation of neurons in the hippocampus, and people with prolonged stress have seen that they have smaller hippocampus, huh? And another structure, prefrontal cortex, this is also closely associated with uh, amygdala. It is related to threat and fear, and it becomes activated uh, when it becomes it is strengthened. As a result, brain responds faster to perceived danger and struggles to make it calm. Huh? And brain find it harder to regulate the emotional reactions, and it ultimately leads to depression. If the cortisol level remains high for long diseases, we suffer from psychosomatic diseases. Psychosomatic diseases are very common these days. Diabetes, diabetes type 2, and hypertension, bronchial asthma, irritable bowel syndrome. They're all related to stress. Next comes another slide. We have trillions of microbiota in our gut. Their balance is necessary for our mental health. If their balance is dysregulated, there is dysregulation of neurotransmitters, which ultimately leads to anxiety and mood disorder, and ultimately to stress and other disorders. So it is important to have nutrient good food and prebiotics and probiotics, uh, um, and fibers, fruit, yogurt, banana, like that, in our diet to keep our gut microbiome healthy, and you have to avoid uh, highly processed food to make it also healthy also. Now comes the microbiome produces serotonin and dopamine, and the imbalances in the microbiome releases anxiety and depression, and ultimately stress. Poor diet means poor diet lacking in prebiotics, probiotics, and high in processed uh, food. And the people who consume a lot of antibiotics without consulting the doctor, they have a disbalance. and chronic stress, that is the cortisol level, affects the gut-brain axis also. Thyroid plays an important role in mental health. Huh? It's a hormone, thyroid hormone. Main symptom of hypothyroidism is depression, fatigue, and cognitive impairments like poor concentration and short-term memory lapses. If the hypothyroidism secretes more, thyroid gland secretes more, that is hypothyroidism. It leads to anxiety, nervousness, irritability, mood swings, and sleep disturbances. Now, what role physiology plays in our mental health? Exercise physiology, physical exercise. Huh? The endorphin, when we take regular physical exercises, the body secretes endorphin. It reduces pain. It is body's natural painkiller. Endorphin improves mood and promotes a sense of well-being. If someone takes a regular exercise, he must have good mood. And next chemical, brain derived neurotrophic factor, BDNF. It helps neuroplasticity, synaptic health, and neuroprotection. Keeps our nerves and central nervous system in a good, healthy condition. The neurotransmitters, what I have told you earlier, dopamine that boosts motivation, serotonin that regulates mood, sleep and relieves stress, and non-epinephrine that sharpens focus. These neurotransmitters are released, are secreted more with the when we exercise more. Not moderate level, not more, moderate level. In the structural level, the volume of hippocampus also increases, it improves our memory. Now the modern day problem, screen time means mostly the mobile addiction, mobile and in the psychophysiology behind it. It has been seen that young generation spend 10 to 12 hours or more, even more if the find scope. Huh? They are always glued to the screen, mobile screen. This digital overstimulation thins the cortex, and so that our performance of the cortical brain is reduced. It leads to irritability. It proves the pathways, the neuronal pathways, huh, for imagination, patience. You see, the people are accustomed to see small reels of few second duration. They will not be able to concentrate for a long time and have a deeper understanding of any subject. Concentration is also low, and planning. If they see everything on the screen, they cannot anticipate and plan with the real world needs. And there is a serious consequence. The students perform poorly if they are addicted to uh, social media or gaming. This unusual dopamine spike occurs huh, due to addiction. Huh? And the blue light emitted from the mobile screen mimics the daylight. It fools our brain and it reduces the it suppresses the formation of melatonin. Ultimately leads to poor sleep and poor mood disorders and emotional dysregulation. And when we are engaged in physical activities, huh, we do less exercise. That means it may lead to anxiety and depression. What are the physiological strategies so that we can improve our mental health. Firstly, the exercise, physical exercise of moderate level. That means the about 150 minutes per week reduces the risk of depression by 20 to 30%. This is very important. And the exercise acts as mild medicine for depression, for mild to moderate depression. And sleep should be sufficient sleep, and sleep schedule should be consistent, because sleep has a unique function. It uh, removes the metabolic waste through lymphatic system. It regulates mood, and it also helps to help us to consolidate memory. So sleep schedule should be good. If you go to sleep one day at 10 o'clock in the night, next day at 3 p.m. in the night, this irregularity hampers the mental health. And sleep should be 6 to 8 hours according to the need of the body and activity. Diet. Diet plays an important role to maintain our mental health. Diet should include prebiotics uh, and probiotics, uh, fruits, yogurt, fiber-rich diet that maintains the health of the microbiota, the balances of the balances within the our gut. And we should reduce ultra processed food. Ultra processed means sausage or like that, trans fat, highly deep fried food, and refined sugar. They also hampers the gut microbiome. Refined sugar also invites uh, the diabetes. uh, uh, and the omega-3 fatty acid helps our neuron for neuronal growth, and B complex and essential amino acid are essential for neurotransmitter secretion. Suppose if we don't include tryptophan and essential amino acid in our diet, we may have serotonin and uh, melatonin deprivation. Vitamin B also plays an important role. Stress management. Stress management is very important. Nowadays, our life has become stressful than previous generation. Yoga, pranayama, meditation, and relaxation techniques are very important. I'm going to show you a slide. This is by World Health Organization. What World Health Organization says? That 5 weeks of yogic practices, only 5, reduction in anxiety and depression, and 8 weeks of yogic practices improves our sleep quality, and 24 weeks of yogic practices, reduction in pain, better moods, where mood becomes stable, and we have uh, uh, an increased energy level. That means we have less fatigues. So yoga plays an important role, and in modern society, the place for physical exercise have reduced. So it is better to have practice yoga in our room. And pranayama. Pranayama means controlled, regulated breathing. And we have seen when we become emotionally unstable, there is irregularity in our breathing level. And alternately, if we make our breathing regular and slow, automatically it has been established that it stimulates the parasympathetic nervous system and makes us calm. Meditation, the same way, makes us helps us to manage stress, and relaxation techniques. Yoga also includes many relaxation techniques. Apart from that, um, quick relaxation, instant relaxation technique, deep relaxation technique, or maybe followed. There is also a relaxation technique called Jacobson's progressive muscle relaxation technique, and that helps uh, for stress management. Digital well-being. Digital well-being, judicious use of social media. I'm not advocating for not to use social media or smartphone, but you must use it um, for your own benefit. Huh? And there is an app. The name is also digital well-being, by which you can have an audit how much time you have spent after gaming or social media like that. You can and you can control accordingly. Now the lifestyle changes. Final one. Uh, Lifestyle changes. If we do just mechanically, if someone else tells you, huh, it will not be permanent. If you know the mechanism, what your physical activity or activities are doing to your psychology or mental health and physical level, then only you will be able to make behavioral changes that will be uh, imprinted on your brain, and it will have a permanent impression on brain, and then only the behavioral change will be beneficial and it will be permanent. Otherwise, after doing some days, it will leave everything. For permanent changes in your lifestyle, both cognitive and behavioral changes are essential. Thank you, everybody.
Thank you, Mr. Dipankar Pal. We have at least only a single question,
Ah,
uh, and it's Dr. Shomendra Dorbar who asks, how do we handle childhood depression and mental disorder?
no. If first we have to make a history of the patient. If there is the first there any stressor in his life, whether there is any family history, how his personality is, you have to assess all these things. Then you have to exclude those criteria, and then what are the triggering factor, how his lifestyle is. The first, he's not the childhood depression are now becoming common nowadays, huh? And then he should be encouraged to do things, and he should be able to do exercises, have food what I have said, huh? And he must not use smartphones like that, huh? That will help him to come out of the childhood depression. Hello.
Yeah. And now, Mr. Pal, now I had a question
Ah,
uh, that what about the children, school going children who
ah.
are suffering from ADHD? Can
Oh
a serotonin or dopamine supplement
no, that
reduce
I have
the
no idea about those.
ADHD in the school going children? Because what I perceive or what I go on through school children's a survey, they most of the young students
Ah,
they are actually suffer from ADHD, and the family is suffering, the teachers are suffering because of this ADHD. So,
ah.
what could be a possible way to
No,
manage
possible.
this
Generally,
ADHD in the young children?
generally ADHD goes away with the when he reaches the child reaches 14 or 15 years age. But if it persists, it requires medication.
Okay.
And the
So,
simple task for maybe given. Suppose he may be asked to may find out, give a newspaper, give him a newspaper and find out the A's. He may concentrate on that. And if he does that, give him a lozenge. If he finds the word letter C or K or S, give him he will put much time on the paper and he will just count. Or he may be asked to make a garland of small beads of different color. First he will be asked to make a garland of only black beads. Then he will be asked to make a black bead and white bead. Then ask him to make a garland of one black, one red, one uh, white bead, like that, so that he will be engaged in that. And if he does any work for a small period of time, you will not don't expect a long prolonged attention from him. Just give him a 5 minute work. If he does, reward him. Not only any food or like that, but you pat him, appreciate him. That you will also do. Hello.
yeah, thank you, Mr. Pal, for this wonderful lecture on psychology and physiology and how to manage stress.
Stress is a part and parcel of our life.
Yeah. And I think we are at the fag end of your lecture session. And
Yes.
I take this opportunity to give the vote of thanks officially. So thank you, Mr. Dipankar Pal, for giving this exciting lecture on mental health well-being and keeping yoga as a part of the remedy to come up of this stressful life in today's scenario. I take the opportunity to thank our President of Physiological Society of India, Professor Proshan Priyo Nayak, our Secretary, Professor Rajan Haldar of PSI, our Treasurer, Dr. Sritinathan Tripathi, who had all tried to arrange or help us to celebrate a week-long foundation day of the Physiological Society of India. Uh, I take this opportunity to thank all the participants as well as who are at the backstage, making this week-long celebration of PSI Week a grand success. Thank you,
Thank you, Sampa,
Mr.
Dr.
Pal again.
Sampa.
Thank you.
Thank you. I must thank the President, Proshan Priyo, and Secretary, Dr. Rajan Haldar, and you, and also the Treasurer, and all other associated with Physiological Society of India. And especially, I must thank my friend Sharmishta Ghosh for encouraging me to join this program, and she has done a great job behind me.
Thank you.
Thank you.